Hello there. Happy Friday. Thanks so much for joining me today. My name is Julie Hirschberg. I am the owner, founder of Reactive Therapy and Wellness in the Los Angeles area, and so happy to share with you every week all of the things that we're doing and learning here with our amazing team. We do have an amazing team. I feel so lucky. Every day to work with them. And our team is has been diving into functional movement disorders this month. It's a big topic in the therapy world. It's something that we talk about a lot. We are looking at the literature, we teach on it. It has been the theme this month with our Brain Bites group, and we have just learned so much. Part of our Brain Bites group and part of our advanced movement disorder certificates for therapists is looking at the assessment and treatment of functional movement disorders. And we did a course on it this month, and we've been following up with cases and things like that. And I've just been sharing little tidbits of that. And so today I wanted to share a couple of things in regards to treatment of functional movement disorders. I wanted to talk about what's new in some of our understanding, what's the latest in the literature. And literally, there are a couple of things that just came out in the past couple of months looking at multidisciplinary treatment in functional movement disorders. I wanted to share our pie chart. Many people know we love a good pie chart. And I think really what we love is being able to break down some complex things and simplify them and help us all to understand them better. So we're going to talk about the pie chart in terms of treatment and give some examples of things within different parts of the pie chart. So let's dive in. First of all, if you're new with us and new to functional movement disorders, you may be wondering, what is this exactly? So a functional movement disorder is a movement disorder that is characterized by an involuntary but learned habitual movement pattern that's driven, so this is the underlying contribution here, driven by abnormal self-directed attention. And what is important about this is that it's not due to an isolated lesion, but an overall function or connectivity in the nervous system. So we can see things like tremor, dystonia, weakness, even like tone and contractures driven by this dynamic lesion of a functional movement disorder. It's something that we see a lot at Reactive. We have an interdisciplinary program to work with people who have functional movement disorders, and we get a lot of questions from other PTs and OTs because this is one of those things that just hasn't been taught a lot in schools. So we like to dive into that stuff. So let's talk a little bit about what's the latest in the literature. And I actually wanted to pull up an article here so that I can share it with you. There were a couple of groups that published just in the last couple of months evaluations of multidisciplinary inpatient treatment for functional movement disorders. One group out of Germany and one group out of Chicago. And there's not a lot of programs for inpatient treatment, by the way. So this is an important component to think about when considering treatment for people with functional movement disorders. Both of these, though, looked at a multidisciplinary approach. And you've heard me talk before probably about having this team and how important I feel that this is for people with functional movement disorders, not just PT, not just OT, not just psych, not just speech therapy, but the whole team. As it's indicated for the person. So the group in Germany, let me give you the title of the article. It's in the Movement Disorder Clinical Practice Journal and led by Tamara Schmidt. This is the group from Germany. It's evaluation of an individualized multidisciplinary inpatient treatment for functional movement disorders. Just came out in the journal from the Movement Disorder Society. And what I really liked about their article is that they have a special team that's trained in functional movement disorders. And they go through in the article to talk about what it takes in their program. And it's very goal directed, which we know is part of what it takes in treatment. So an external focus of a goal. Versus a body focus, which can kind of send the brain haywire, and really building a trusting relationship with a person. What I have found a lot in functional movement disorders, as well as many other neurologic disorders, is that a lot of people have gone to multiple practitioners and not been understood, and really have felt a lot of mistrust with medical providers. And Naomi asked a question here, does this relate to 3PD? I have this, thanks. This does relate to 3PD because 3PD is a functional dizziness disorder. So much like a functional movement disorder or the other umbrella term of functional neurologic disorders, 3PD falls under this. And we use the treatment pie for 3PD as well. So thanks for asking that question. And since you're joining us, I will talk a little bit about that as we talk about functional movement disorders. So same for 3PD as functional movement disorders, you want that team approach. And that's what this inpatient rehab study did. They had weekly team meetings and a lot of talk between the team members. This is another thing that we are noticing in our interdisciplinary group is we have a weekly team meeting. We're talking all week long to discuss the case and learn from one another, and really address goals from a different angle too. I think that's so valuable, and I think has really underscored the recovery that we've seen in people going through our program as well. So that integrative approach, that interdisciplinary approach, and the program that they held inpatient had three main objectives. I love these. So develop a consistent and easily comprehensible disease concept for a disease that's difficult to understand. Functional movement disorders, functional dizziness like 3PD can be very hard to understand because of the nature of this dynamic lesion, so to speak, in the brain. To improve body perception, love that. We get into our sensory systems to retrain physiologic movement patterns, so to retrain some of those automatic movement patterns, and reintegrate potentially components that were traumatizing or overwhelming. So I really love that they incorporated this into their treatment, and they had really stellar results. So they showed that people with FMD had great improvement over time. And they looked at, I think, 23 people over the course of inpatient rehab, and then at a 5-month following, and they had a significant improvement in their movement disorder and a stable reduction of symptoms. So important to see that stability. So this kind of individualized, multidisciplinary inpatient rehab program this was in Germany, just published in the Movement Disorders, showed improvement with this very specific approach. Now, we have seen this in the outpatient setting as well. So there's been studies in the outpatient setting. One study is underway right now in the UK, a large study looking at outpatient. We're certainly in the outpatient setting as well, and I think you can get some of these same results there, but there is something very valuable about being out of your context and environment and being in the inpatient setting too. So that is just some of the most recent research. And I wanted to share with you the pie chart, which summarizes some of the literature that we know, as well as clinical experience of the different areas in functional disorders that we want to look at and build our treatment program around. And this is we have to look at their assessment first. So I did an Instagram video on the assessment pieces just this week, so you can catch that. And by the way, every Friday, if you're a therapist who really loves diving into this, every Friday I put together the videos that we've put out during the week, as well as links to articles and resources and other video resources, and I put them all together in a nice package for you in our Friday newsletter. So it comes out every Friday evening. If you sign up, let me see if I have a link here. If you sign up on our education list, we'll send you this every Friday. So all the videos, all the resources, all the research articles, and our recommendations. So this is the pie chart that we did this week on assessment, and it goes right into treatment. So I want to give you some ideas of the different areas of treatment that you may assess based or treatment that you may do based on your assessment. I got ahead of myself there. These key areas are so important. So we go from physical limitations, autonomic, lifestyle, psychosocial, sensory, and motor control. You can see sensory and motor control, autonomic are some of the biggest pieces that we hit on. And these are pieces not traditionally hit on in your traditional therapy. So that's why I talk about those a lot. I'm going to give an example from each of these areas so you get an idea of how we might incorporate this into treatment. So let's talk about physical limitations first. This is something so important. This is bread and butter of physical therapy, but I can't tell you how much sometimes once we go into the functional neurologic disorder realm, we start to ignore those things. And often we find that there are contributing factors that are physical limitations. One of the biggest ones is neural tension, impaired nerve dynamics. And this is often a trigger for tremor. So first you have to assess it. So don't willy-nilly treat this if it's not impaired, but assess it and then incorporate it into treatment. And so I love a good thoracic spine manipulation. I love doing some nerve slides or tensioners if it's needed. And so look at that, especially if you see somebody with tremor. Talking about functional dizziness or 3PD, we have to look at the underlying contributions from the vestibular and the oculomotor system. And I kind of include these in the sensory systems, but if we're not looking at otolith function, if we're not looking at full extraocular control and ensuring that that initial vestibular insult is not resolved, then we're missing a whole piece of the pie. Something I see a lot is a cervicogenic component contributing for that. The second is motor control. So that's a really big piece of the pie. And I think this is probably one of the biggest pieces that we usually address in a functional movement disorder. It's in the definition, right? It's a motor control disorder. Optimal theory is the way that we would incorporate so much of the motor control and motor learning theories. So autonomy, providing autonomy, and an external focus. Huge wins here. This goes for 3PD and functional dizziness as well. If we can move to access those automatic balance responses and movement responses and vision, and take away from the components that have occurred to cause an overweighting of the visual system in 3PD, we can really have a huge win. So optimal theory in addressing motor control. In the sensory system, again, you got to test it to treat it, but joint position training, joint position error testing, and then training has been a big focus for a lot of people I've worked with lately. And I really have to thank our colleagues Jamie and Catherine. They're leading a one-day course for us, by the way. It's coming up in August, a positive spin on dizziness. But looking at the otolith function and how that might be contributing to somebody's movement problem or to their 3PD as well. So another underlooked area. And then when we find that, incorporating things like the use of weighting to the body, that can be a huge source of improvement for people with functional movement disorders. Okay, down here we've got psychosocial areas, and I'm so thankful we have a neuropsychologist on our team to be able to attend to this. But here is where I think if we can really focus on providing a safe space for a person to share their story and explore movement safely, that goes a very, very long way. So when we provide autonomy, when we provide control, when we provide safety, it helps a person relearn movement. So I think that's a big area that we can contribute from the psychosocial realm. Okay, we're almost through all the pieces of the pie here. So we've got lifestyle. Again, we've got amazing OTs here. Sleep hygiene is a really, really big factor in functional disorders and functional dizziness. So we incorporate sleep hygiene into our practice, and pacing. So a lot of people that I've worked with have go, and then crash. And the nervous system, their nervous systems, the way they're set up, it just doesn't work well that way. So we work a lot with our OT to help find the right pacing for that person. It's not a one-size-fits-all approach. Last, but certainly not least, is autonomic. One of my favorite topics. I just can't get enough of this. And this is so individual as to what works intervention-wise for people, because you have to assess it where they lie in their window of tolerance, parasympathetic and sympathetic, and then treat. So exploring things like breath work and an extended exhale, grounding activities. We've been using a lot of rhythmic movement and dance as part of that autonomic regulation as well. And again, I can't hone in enough, that sense of safety in your therapy session is a big part of regulating the autonomic nervous system as well. So we hit on all the pieces of the pie, from physical limitations to autonomic, lifestyle, psychosocial, sensory, motor control. These are all pieces we need to assess in detail and then incorporate into treatment in a very thorough way for a person with a functional movement disorder or functional dizziness or CRPS. There's so many things under the realm of functional neurologic disorders, and we can have great success when we assess and treat all components of the pie. So I hope that was really helpful for you for getting some treatment ideas. Again, if you find this helpful, I'm going to send out an email at the end of the day with some of the research articles that I just brought up today. So the latest and greatest in functional movement disorders, some of the resources online that I use to help educate people on this, as well as the videos that we did this week. So join our learning party. I put the link in there, and I really hope to see you in there. I love to hear from people. I love to hear your stories, the things that maybe you're struggling with people, and turn them into these videos that we do all the time. Bottom line is that there is evidence, there is hope for people with functional movement disorders for really getting full recovery when we look at the whole person and include a whole interdisciplinary treatment. So thanks so much for joining me today. I can't wait to see you next week and hear from you in our newsletter too during the week. So have a great day. Have a great weekend.